Welcome to The Explainer. Today, we're going to decode the story your lungs are trying to tell you. A story written in the language of a pulmonary function test, or PFT.
Okay, so let's just dive right in. You see a report like this, and it can look, well, pretty intimidating, right? All these numbers and squiggly lines. But really, you should think of it like a detective story. There are three main types of clues that tell us exactly what's going on inside your lungs. To really get the big picture, clinicians are looking at these three key things. First, airflow. How fast can you breathe out? Second, lung volume. Just how much air can your lungs actually hold? And third, gas transfer. How good are your lungs at their main job, getting oxygen into your blood? These are the three pillars of the whole investigation. So let's start with the most common clue, which is airflow. This is all about how fast you can get air out of your lungs. And investigating this is how we start the hunt for something called an obstructive pattern. All right, the number one clue here is something called the FEV1/FVC ratio. So what is that? Well, FEV1 is the amount of air you can just blast out in that very first second. And FVC is the total amount of air you can possibly force out after your deepest breath. The ratio between them, that's our single best tool for spotting any blockages or narrowing in your airways.
So if that FEV1 over FVC ratio is low, it's a big red flag. It means you're not getting a big percentage of your air out in that first crucial second, and that points right to an obstructive pattern. The coffee stirrer analogy is just perfect. It's like you're trying to blow through a tiny straw instead of a big open tube. There's a bottleneck somewhere.
And here's what it looks like on one of those graphs. See that? Healthy airflow gives you a quick, sharp peak. That's you blasting the air out. And then a nice, straight line sloping down as your lungs empty. It's clean, it's efficient, that's what you want to see. But this is what an obstructive pattern looks like. See the difference? That classic scooped-out curve tells a totally different story. It shows that as your lungs get emptier, the airflow is slowing way, way down. It means the airways are probably collapsing a bit or getting narrow, and it's trapping air inside.
Okay, so we've looked at airflow. Now let's move on to our second big clue, lung volume. We're going to shift gears here, because now we're not looking for blockages. We're looking for a completely different pattern called restriction. And this is all about the size of your lungs.
Now, if your FVC, remember that's the total amount of air you can blow out, is low, it's really tempting to jump to a conclusion. You might think, oh, my lungs must be small. But hold on, it's not always that simple. That low number could actually be a bit of a red herring. So, to solve this little mystery, we need another piece of evidence. It's called total lung capacity, or TLC. This is the absolute maximum amount of air your lungs can hold, period. But here's the catch. That simple blowing test, the spirometry, can't measure it. You need a different, more specialized test to get this number. And this is the crucial point. True restriction is only confirmed when your total lung capacity is also low. That means your lungs are physically smaller, or they can't expand all the way, kind of like a stiff, small balloon. If your TLC is actually normal or even high, then that low FBC we saw earlier was probably because of air trapping from an obstruction, not because of restriction. See how the clues fit together? Okay, finally, let's look at that third pillar, which is really the whole point of breathing in the first place. It's not just about moving air around, it's about getting that life-giving oxygen from the air into your bloodstream. The test for this is called the DLCO, and it basically measures how efficiently that gas exchange is happening across that super delicate barrier between your air sacs and your blood vessels. If this number is low, it could mean there's an issue with the lung tissue itself, making it harder for oxygen to make that critical jump into your blood. So sometimes the first few clues point us in a certain direction, but to really crack the case, we need a couple more specialized tests to get a clearer picture. One of the most common follow-ups is seeing what happens after you take a puff of a bronchodilator, a medicine like albuterol that's designed to open up your airways. We do this to see if any obstruction we found is reversible. And the rule for this has actually gotten a lot simpler recently. A significant positive response is now just an improvement in either your FEV1 or your FVC of more than 10% of what's predicted for you. It's a nice, clean, objective way to measure if the medicine worked. And you gotta remember this, a single PFT is just a snapshot. It's what was happening on one particular day. The real story, the full picture, often comes from tracking these results over time. That's how you really know if your lung function is stable, getting better or getting worse. So, after our detective has gathered all the clues from airflow, from lung volume, maybe a few of those follow-up tests, what does the final report actually tell us?
Well, it all comes down to putting those clues together to identify one of these main patterns. An obstructive pattern has that key low FEV1/FVC ratio. A restrictive pattern has a low FVC and a low TLC. And a mixed pattern, well, as you can probably guess, it has features of both.
Now, this right here is probably the most important takeaway of all. A PFT identifies a pattern: obstructive, restrictive, mixed. It tells your doctor how your lungs are working, not why they're working that way. The test itself doesn't say, you have asthma or you have fibrosis. It just gives the physiological clues. Your doctor is the one who puts those clues together with your symptoms and your history to solve the final mystery. So now that you know how to help decode these clues, you're in a much better position. You get the difference between obstruction and restriction. You know why TLC matters. You know what those graphs are showing. The story is in the patterns. And now you can have a much more informed, much more productive conversation with your doctor about what your results really mean for you.